Hello and welcome to another Healthy Bite. My name is Dr. Ron Ehrlich. I'd like to acknowledge the traditional custodians of the land on which I am recording this podcast, the Gadigal people of the Eora Nation, and pay my respects to their elders, past, present, and emerging. Welcome, John.
Indeed, good to see you.
John, you have had such a long career in dentistry. I wondered if you had to summarise what you were doing. Well, how would you describe your focus on your professional life?
On my professional life, in one word, I would say the truth. But I'm at odds with the conventional orthodontists, and I think that they are very mistaken, shall I say.
How have they got it wrong? Tell us about that.
Interesting question. I'll have to go back in a bit of history here. Originally, people had straight teeth, if you go back even a few hundred years. Around the end of the 19th century, a lot of people began to get teeth crooked. And the dentists found that if they pushed with bits of wire, they could straighten the teeth. So they thought that was a good idea, and that was the birth of orthodontics. But they never really, I think, studied the logic of what they do. Because if everybody had straight teeth 500 years ago, why don't they now? And I'm being an inquisitive chap, I just explored it. It was quite obvious that it was to do with our lifestyle. You know, if we eat soft food, live in houses, and don't breastfeed, it'll mess up the natural process, which results in a good-looking face with straight teeth.
Yes, I think people don't actually appreciate it's come to be normalised, really, hasn't it? That crooked teeth, not enough room for all 32 teeth, is actually quite normal. Why does it matter?
Well, in this modern world, it is normal. And indeed, it doesn't make any difference to how you can eat. You can eat with very few teeth, with the mush that we eat these days. But the side effect is that one has a deformed face because the jaws don't go properly, nor does your face.
You started your career as an orthodontics surgeon. You were doing surgery initially.
Yes, that gave me a huge leg up because I realized the difference that shifting the bones about would make. I used to cut the bones and bolt them together in different positions.
That sounds, I'm sure our listener is now picking themselves up off the ground just thinking about that. What was the turning point for you that changed your approach from orthodontic surgery, which, as you say, is the movement of facial bones, to orthotropics? And actually, we should talk about what orthotropics is.
Well, which do you want first?
Let's talk about orthotropics, because then we can know where you've come to.
Well, as I say, orthodontists believe we are born with deformed faces, those of us that have them. But orthotropists say we have the natural ability to grow almost perfectly, but that doesn't occur because of our lifestyle.
Okay, and what was the turning point that took you from surgery to orthotropics?
Well, one was the lifestyle of surgeons. They call it an operating theatre, and it is a theatre. I've seen famous surgeons throw instruments across the room, and it is a very high, tense occupation. Everybody can see when you do it right or do it wrong. And the emotional strain is very large. Also, to be frank, I didn't like the blood. And I then, because I was moving faces around, I just was interested in the whole process. And the more I dug into it, the more I realized that the shape of the face is no more than the shape of the bones, and that they should be okay, but in most people are not.
And this is what intrigues me, that we've like evolved to have 5 fingers on each hand. And if we didn't have enough room for those 5 fingers, I'm sure we wouldn't be as blasé about it as we are for the fact that we don't have enough room for the teeth we've evolved to have.
Well, you might be right there, but it's hard to be certain that we would realize. People are very stupid in the short run, although they normally get it right in the end.
So your challenge to the profession really was that there was a better way of doing things. Now, before we go in a natural way, but I think we should remind our listener what the way of doing things was, or perhaps to some degree still is.
Well, the conventional orthodontic approach, as you say, is primarily mechanical. It's also surgical, but primarily orthodontists use mechanics to line the teeth. They do that very efficiently. Fixed appliances, you know, the ones that glue onto the teeth, they're guided into position with a bit of wire, and the teeth finish in a beautiful alignment. They're very clever at that. But my research showed quite definitely that in that process, they move the whole of the middle part of the face backwards. And it is that which does the damage. And of course, that is why they have to extract teeth, because otherwise there isn't room.
So the orthotropic, how does the orthotropic approach differ from that?
Well, the orthotropic approach, if in a young child of under 8, all you need to do is correct their posture. For older people who have grown up with their posture incorrect, then the bones and indeed the teeth will be incorrect too. And therefore you have to use something to correct them. Orthotropists use the minimal of movement of teeth. Teeth are not meant to be moved. Orthodontists move them. And in fact, that causes a lot of damage. The roots of teeth are always damaged when you use fixed appliances. To me, that is a bad thing. And indeed, it's not necessary if you can guide the growth simply by training the posture, perhaps assisted a little bit with appliances.
See, I don't think people often, and I include many dentists in this, don't often connect the lower half of the face with posture. What's the connection there? Tell us about the connection.
The connection is very simple. If you leave your mouth open, as most people, even you do, and me, your face will go down, your cheeks will be flat, and your nose will stick out because it's attached to your forehead, and your chin will then drop down and swing back. You will look considerably less attractive. All the people who keep their mouths shut have what we call forward growth. Those that leave their mouth open have vertical growth. Like me, I have a long face, my cheeks are very flat, and you know, I may have a strong personality, but I certainly don't have a good-looking face.
You're being harsh, John, but I think I understand what you're saying. And the thing about pulling things back, I think we kind of touched on posture, but it's also connected to airway, which is another one that really is a lot of the people and a lot of the profession also don't make that connection.
Yes.
Tell us about the airway.
I was going to say that the airway connection is secondary. I talked earlier on about correct posture and said leaving the mouth open will deform the face. But also, if your tongue is not on the palate, then your teeth will collapse, your bones will collapse, and you will look unattractive. I could post you a picture or several pictures showing exactly that. People who left their mouths open and their faces have been destroyed. But the obstruction of the airway is secondary, because if the face doesn't go forward, there's naturally less room for the air to go down. And also, if the tongue is not on the palate, it tends to drop back and block the airways. So there are several factors.
Well, now, how common is the problem of that?
Well,
exactly
it's restricted to about 95% of the population.
95%. So that is quite an extraordinary statistic, which has blown me away through my whole professional life. Tell me, when you developed this whole orthotropic approach of growing faces, of allowing nature to take its natural course, how was that received by the profession?
Very badly. I wrote a paper in 1981 called The Tropic Premise. Basically, all it says is that for correct growth of the face and jaws, you need to keep your tongue on your palate and your mouth closed. Not totally, but more or less.
How often, how long in a day, how should our teeth be? You're mentioning rest position tell us about how things ideally should be.
Well, the tongue should be on the palate and the teeth should be either touching or nearly touching. They should be in very light contact. I think my son calls it butterfly contact for about 6 hours a day. If they're not, they will overgrow. After each meal, your face is shorter. When you wake up in the morning, it's longer.
And clenching and grinding, quite a big problem in our society.
Yes,
what effect does that have?
That is a pathology. It arises if you don't keep your mouth shut enough, then your teeth will erupt to different heights. And so when you close, you could be applied to you. When you close, do all your teeth meet at exactly the same time, or do some teeth meet more than others?
Yes, no, there's a problem with evenness. They ideally should be even when you bring your teeth together.
Yes, but there is an automatic mechanism in the body, which I call the tooth eruption mechanism, which means that every tooth has its own ability to erupt or intrude. This is necessary for the human animal and indeed for all mammals. All the teeth must touch perfectly or the animal wouldn't survive. In the humans, we survive because we can eat soft food and it doesn't matter. But the side effect is that because the teeth meet unevenly, patients are always looking for the correct place for the teeth to come together. Therefore, they brux, and that is the cause of it.
So a type of autocorrection, trying to correct the imperfection.
It's easy to correct. Just keep your teeth in light contact for 6 hours. That will cure anybody. But, of course, changing your posture is difficult, especially for adults who, like you, have poor posture. Sorry to be rude, but I can see it at a glance. And as I say, 95% of the world do have poor posture.
Tell me, you mentioned 8-year-old, you just correct the posture and it will correct itself.
Yeah.
Is there at what age can we make these corrections though, with the help of professionals?
It depends, of course, on severity, but essentially, I think you could correct any child if you started at 5 or 6. Certainly, the best time is soon after birth. Most mothers have no idea that if their baby leaves her mouth open, it will destroy their face.
Well, it's a very well, as you say, it's a very common problem. I mean, part of that is the fact that people's nasal passages are blocked or restricted.
But that is that they block as a result of the lack of growth. They don't cause lack of growth. There is some nasal blockage. If you live in a house, you're shut up with lots of allergens. These cause allergies. That causes a runny blocked nose. Therefore, you breathe through your mouth. But there's a sequence there, which basically comes from living indoors. If someone asked me the best way to bring up their children, I would say sell your house and buy a cave in the top of a mountain.
I think that's going to narrow down the number of people that are going to be able to correct those. There's not that many caves out there. I don't know. Maybe in Sussex there is, but
yes.
In Sydney we're lacking caves.
Yes, it's not many people take that option.
No. But you would say that adults, this is, how do you feel about adults making these kind of corrections?
Well,
orthopedically, orthotropically.
Have you heard of the phenomena of mewing? Is that a word?
Yes, I have. And if you could tell us about mewing.
Well, I wrote this paper in 1981 saying that if you keep correct posture, your face will either not go wrong in the first place, or even if it has gone wrong, will improve. The orthodontists laughed at it, but I think 50 years later, my son described that on Facebook, and it opened, I don't know what the word is, but an incredibly large number of people now mew. I'm told that it's around 30 million. I have no idea if that's true or not.
But tell me, what is mewing?
It is simply putting the tongue on the palate and keeping the mouth shut. It is also swallowing correctly, but that is associated with an incorrect tongue posture.
And you mentioned the profession. I mean, I know you've been teaching this since the 1980s. A long time. And I mean, there has been a change in orthodontics, hasn't there? Have orthodontists come to accept? I know in Australia, 4 bicuspid extraction, we were the inventors of it, I think, was very common, but that's not so much anymore.
And you're absolutely right. It was basically propagated by Raymond de Bègue, who extracted 4 premolars routinely. I've been lecturing in Australia for, I would think, nearly 60 years. And when I first went there, I was ridiculed. But you're right. There are a very large number of people now say, yes, don't extract premolars. But of course, the treatment hasn't necessarily changed. What happens is they don't extract the premolars, but they push all the teeth back, with the result there isn't room for the wisdom teeth at the age of 18 or 20. By then, the patient has long forgotten about their orthodontist or indeed their orthodontic treatment. Therefore, they don't get the blame. But in actual fact, it is because their treatment, the fixed appliances, pulls all the teeth and indeed the jaws back. There is not room for the wisdom teeth.
So is the orthotropic approach, there will be room for the wisdom teeth? That is a measure of success?
Yes, it depends on your age. If you're on my age, not much hope. But in a 5-year-old, yes, without any treatment. But I treat many people in their late teens who've been told they've either got to have their wisdom teeth extracted or indeed they've got to have surgery to chop their jaws up and bolt them together in another position. I treat them with orthotropics. I could show you examples of that too. I might say I have very, very few failures with children who've been told they need surgery. Mainly that is because it gives them a very good incentive to wear the appliances I use, which are not convenient or comfortable.
Are the appliances worn just at night or full time? How are they worn?
Well, initially, you need to enlarge and reposition, indeed, the upper jaw, because that is attached to the skull, and there you've got to have some physical movement. You only need that if the child is over 6 or so and has a narrow jaw. But narrow jaws are almost routine. The width of the upper jaw between your first molars, those are the big ones, should be for a man about 44 millimeters. The average in the UK is 33.5. So that is over 10 millimeters too narrow. That's why there isn't room for the teeth.
And I think the fact that literally the shape and size of the mouth determines the shape and size of the airway, that's a big difference.
Yes,
from what is ideal.
Wouldn't totally agree with you on that, but generally they're related.
What was it about that statement that you wouldn't agree
Well,
with?
I'm saying I think the airway is blocked by the tongue. But obviously, if the jaws are too far back, the tongue is more likely to obstruct. If with orthotropics, we take the jaws forward. Again, if you wish, I could post you some photographs. But the jaws, with orthotropics, I can grow the jaws 10, 15, sometimes 20 or even 25 millimeters forward. My orthodontic colleagues tell me it is impossible to move them more than 2, perhaps 3 millimeters. That is a simply vast difference.
That is a huge difference. That is a huge difference. One of the arguments, and I know this is true for every form of orthodontics, is how stable is the result? You know, so many people have had whatever, 4 bicuspid extractions, 8 bicuspid extractions, wisdom tooth, they've got 20 teeth in their mouth and they've had orthodontics and they've relapsed. And yet, in your cases, they would say, well, they'll relapse, John. Yeah, what do you say about that? Retention is an issue for everyone.
I'm saying that poor posture causes malocclusion and facial deformity.
Yeah.
If you correct the posture, and by this I mean the subconscious posture, then it will not occur again. If you align the teeth and the patient has the correct posture, they will have no risk of relapse subsequently. But of course, it is very difficult to change subconscious posture. Many people, particularly in Australia, give what they call oral myology. That is, they train the children to correct their posture. They mostly do this with exercises. Now, sometimes exercises will change subconscious posture, and indeed, this is what they try to do. But exercises alone are a very uncertain way of correcting subconscious posture. The child will shut their mouth whenever their mother looks at them, but the rest of the time they're open.
I know I've become very self-conscious about that, but I have for many years. I've tried, but myofunctional therapy, yes, is very popular in Australia. I think the whole Myo Munchie group tries to correct that. I've often described the tongue as the best orthodontic appliance known to man, woman, or child. You're basically confirming that. Is that how you would describe it?
I think that is a very good description. I think tongue posture is the cause of malocclusion.
But listen, are you optimistic about the way the profession is developing? Is that, you see positive movement?
In certain areas, I see very good movement. You know the name of the treatment that I developed called Orthotropics.
Yes.
That is spreading around the world. Interestingly, it's not spreading within the orthodontic profession. It's spreading within the lay public. Go to the media sites, and most of them will know all about orthotropics. Go to a professional site, and they don't. And I see big problems ahead for everybody. I mean, it's ruined my life simply trying to yes, they've taken my license away because they say what was the phrase? Yes, I'm being deliberately dishonest when I say I can change faces. So they took my license to practice away.
But I think that, from what I read, if that happened, that ended up in court, and you ended up winning that.
Yes. No. Well, I have had different court actions. I did win a court action against the Minister of Health, but my life has been an eternal battle. As you can tell, I'm quite forthright in my views, but that comes from the confidence that I know I'm right. And what's more, I can prove it in every respect.
Yes, it's interesting how resistant to new ideas or different approaches health professionals, maybe this is true in other professions as well, but certainly in medicine and dentistry, it takes a long time for change to occur, doesn't it?
It does. Well, when you consider the sequence People go to university. They're taught by professors who don't teach today's knowledge. They teach yesterday's knowledge. Once people have been taught something at school and been told that that is the only way it should be done, they tend to stick to those views. And I'm sure you and I are the same. We believe what we were taught, and by and large, we live that way.
Well, I often say I only wish I knew as much as I thought I did when I graduated, because the more I learn, the more I realize I don't know. But I don't think many health professionals often think that way. They would rather reject what they don't know rather than challenge themselves. And I think that's one of the most interesting, well, frustrating things, really. I mean, I know I got into orthopedics as a general dentist because I was so appalled at what the orthodontic profession were doing. And that introduced me to your kind of work of developing jaws, of using posture, of thinking about tongues and air. Well, I'm going to use the word airway. I know you, but posture and the tongue position. I think it's important. But the profession's very, very, very conservative, isn't it? Very reluctant to change, threatened by change.
Right, and the vast majority of my dental colleagues think that I'm wrong too, mainly because orthodontists are very clever people and know what they're doing.
Yes, well, they certainly are in their own mind. But tell me, I just want to ask you one last question, because I know you've got a lot on this morning, but I want to ask you a question taking a step back, because, you know, you've had a few years of life. And what do you think, because we're all on a journey in this modern world through life, what do you think the biggest challenge is for individuals on that journey?
Are we talking of individual dentists or individual
No, individual people taking a step back as dentists, just people on a health journey.
My father taught me one very useful belief. There is a reason for everything. With the result that whenever I see a problem, I say, there has to be a cause. I then go on thinking about it until I've come up with the cause. If I don't, I really continue sometimes for years to try and think of what the reason is, because there has to be one.
Yes, and that is finding that cause is the challenge.
You're right. Crooked teeth are not natural. There has to be a reason.
Yes, and
poor facial growth, it only occurs in civilized humans. Therefore, there has to be a reason.
It's amazing that we've come to normalize it and accept it. But when 95% of the population are all in the same boat, it's easier to do that than to question it, really, isn't it?
That is absolutely the reason, which is also the reason that most people don't think there's anything wrong.
Yes, it could also be the reason why we have an epidemic in preventable chronic diseases as well. And we've normalized that as well. John, it's been such a pleasure talking to you. And I have had so much respect for your work over many, many years. I attended, you won't remember this, but I attended one of your courses in the very early 1980s. And I have always admired and respected your work. So thank you so much for joining me today.
Well, thanks very much, Ron. I always enjoy chatting about my work, and I only hope I didn't sound too bombastic.
No, you didn't. And I'm going to keep my mouth shut for the rest of the evening, I promise.
Well, you will find that incredibly difficult because you've left it open all your life. And I don't think you even realized that you did.
Oh, I became very aware of it about 10 or 15 years ago.
Right.
And it's been a work in progress ever since.
Right. Well done. And it does require incredible persistence and concentration to change your posture, which is why most people don't. Anyway,
well, dentistry definitely doesn't help postural problems, that's for sure.
No.
John, thank you so much.
Great. Good to chat.
This podcast provides general information and discussion about medicine, health, and related subjects. For
content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.